Welcome all. Today we are going to see a topic carcinoma of the stomach, and it is an important essay question. So this carcinoma of stomach is more common in males than in females, and the ratio is 2:1. And cancer in the proximal stomach is not associated with H. pylori, that is Helicobacter pylori infection, while carcinoma of body and distal stomach is associated with Helicobacter pylori infection. So next, etiology of gastric cancer. Etiology of gastric cancer includes three main categories. First is lifestyle, that is environmental, occupation, diet and habits. And next was the genetic or familial factors. And next one is the precancerous lesions. So these are the major etiological factors. So under diet and habits, smoking, alcohol, obesity, and consuming diets with low vegetables and diet with decreased vitamin A and C. And next one is consuming red meat, smoked salmon, fish and cabbage also increases the risk for gastric cancer. So persons infected with viruses such as Epstein-Barr virus and persons who work in rubber or coal industries are more prone for gastric cancer. So next factor is commonly lower social status people are prone to distal stomach cancers, while the upper social economic status people are more prone to proximal cancers. So next is the genetic or familial factors. First of all, first degree relative carries increased risks, that is 3 to 6 folds of increased risk for gastric cancer, and people with blood group A has increased risk. Monozygotic twins has increased risk than dizygotic twins, and a familial factor also plays a role here. And Lee-Froman syndrome suffering people. What is this syndrome is? This is a genetic condition where there is mutation in the tumor suppressor gene, and that leads to the increased risk of carcinomas. And next one is the E-cadherin gene mutation. E-cadherin gene is itself a tumor suppressor gene, and any mutation to this gene can cause cancer, and inactivation of tumor suppressor gene P53. So these are the genetic or familial factors. And next one is a precancerous lesion. So the precancerous lesions include long-standing H. pylori infection, chronic gastritis, pernicious anemia, intestinal metaplasia, and persons having adenomatous polyps in the stomach which is greater than 2 cm in size. Next one is A-gamma globulinemia, benign gastric ulcers for a long period of time, and persons who have undergone previous gastric surgery and menetrier disease. So these are the precancerous lesions. Commonly, etiology of gastric cancer can be classified into three headings, that is environmental or occupational or diet or lifestyle habits, and genetic or familial factors, and precancerous lesions. So next, about the classification. There are main 6 classifications. The first one is based upon the gross types, that is based upon the appearance. Lawrence classification, depending upon the depth of invasion. Ming's classification. Who histological classification. Proximal gastric adenocarcinoma, that is Seward classification. So depending upon the gross types, that is depending upon the appearance, it is classified as cauliflower shaped, ulcerative, and lentis plastica. Lentis plastica in the sense leather bottle like appearance. And next one is the Lawrence classification. According to Lawrence classification, it is divided as intestinal type, diffuse type, and others. And depending upon the depth of invasion, it is classified as early and advanced. Early is also known as Japanese classification, and advanced is also known as Borman's classification. So next one is the Ming's classification. Ming classified it as expanding stomach carcinoma and infiltrative stomach carcinoma. This expanding stomach carcinoma is favorable prognosis, and this infiltrative one is unfavorable prognosis. Next one is Who's histological classification. Next is Seward's classification. He classified it as type 1, type 2 and type 3. These are the summarized concepts of classifications of carcinoma of stomach. So first one is the Lawrence classification. Lawrence classification, he divided it as intestinal type, diffuse type and others. Lawrence classification, he divided it as intestinal type, diffuse type and others. So intestinal type, 53% of the cancers are intestinal type and 33% are diffuse type. Intestinal type has favorable prognosis, while this has poor prognosis, and it includes polypoid and superficial types. Synchronous gland formation and definite cellular architecture is the feature of this intestinal type of carcinoma of stomach. And here the appearance is lentis plastica, leather bottle like appearance, and the feature here is ulcerative growth without glandular formation. Here it is polypoid and superficial types. Here appearance is lentis plastica, that is leather bottle like appearance, and here it is synchronous and gland formation is present with definite cellular architecture. Here there is ulcerative growth without gland formation. Here presence of glands is there, and here absence of glands is there. So next, it is more common in H. pylori induced infections, and it is more common in males and in aged individuals, while this is common in blood group A and familial type young people and females. So this is Lawrence classification. And next, depending upon the depth of invasion, depending upon the depth of invasion, it is classified as early and advanced. So in early gastric cancer, there is only involvement of mucosa or submucosa, and in advanced gastric cancer, there is involvement of muscularis and serosa. It is deep and it is superficial. This is the difference. And this early gastric cancer is also known as Japanese classification, and this advanced gastric cancer is known as Bormann's classification. It is named so because early gastric cancer is more prevalent in Japan. Next one is whose histological classification. So coming to whose histological classification of gastric cancers, there is adenocarcinoma, adenosquamous, squamous cell carcinoma, and undifferentiated carcinoma. Under adenocarcinoma, there is papillary, tubular, mucinous, signet ring. So mainly histological classification is of 4 types, that is adenocarcinoma, adenosquamous carcinoma, squamous cell carcinoma, and undifferentiated carcinoma. So adenocarcinoma is further divided as papillary adenocarcinoma, tubular adenocarcinoma, mucinous adenocarcinoma, and signet ring adenocarcinoma. So the other types, adenosquamous, squamous cell carcinoma, and undifferentiated carcinoma. So these are the classification. Next, proximal gastric carcinoma or sewage classification. Here stomach cancer is divided as type 1, type 2 and type 3. Next is the common site of occurrence. So 65% of the gastric carcinomas commonly occur in the pylorus region of the stomach, and 25% in the body of the stomach, and 10% in the fundus of the stomach or in the esophagogastric junction of the stomach. Next, about the spread, there is 4 types of spread. That is, first one is the direct spread, lymphatic spread, blood spread, and transperitoneal spread. So in direct spread, it may be either horizontal spread or vertical spread. In direct spread, horizontal submucosal spread occurs along the stomach wall, and vertical spread occurs by invasion to the adjacent structures. So next one is the lymphatic spread. Through lymphatics, carcinoma of the stomach spreads to other areas of the body. And in blood spread, the common area to where it spreads is to liver. And next one is the transperitoneal spread. Through peritoneum, it spreads as peritoneal seedlings, occurs as Krukenberg's tumors in the ovaries, and forms rectal secondaries. Through transperitoneal spread, it may either end in peritoneal seedlings or Krukenberg's tumors in the ovary, or as rectal secondaries. Next one is the staging of the cancer. So that is as TNM staging. So next is about the clinical features. In case of carcinoma of stomach, there is loss of appetite that leads to loss of weight, early satiety and fatigue. So as a result of all these things, there occurs iron deficiency anemia. In CS stomach, there is presence of upper abdominal pain, vomiting, mass abdomen, dysphagia, jaundice and hematemesis. So the signs include positive troisius sign. So this is nothing but the enlargement of left supraclavicular nodes, and positive troisius sign, this is the presence of thrombophlebitis. There is positive rectovesical secondaries, and there is secondaries in umbilicus, that is known as sister Joseph nodules, and there is presence of Krukenberg's tumor, cutaneous secondaries and ascites. Coming to presentation, it may be either asymptomatic, that is in a case of early gastric cancer or in the cancer of body of the stomach, and non-specific symptoms include indigestion, non-radiating pain, that is not related with the food intake, and specific symptoms such as obstruction, dysphagia and mass feeling depending upon the site of the tumor, and metastasis of the disease causing liver secondaries and ascites and secondaries in ovary, rectovesical pouch and in umbilicus and supraclavicular nodes and in lung and bones. So metastatic disease, metastasis to liver, ascites and secondaries in ovary, rectovesical pouch, umbilicus, supraclavicular nodes, lungs and bones. So unusual presentations include acanthosis nigrans and Irish nose in the axilla. So differential diagnoses include gastritis, pancreatic mass and transverse colon carcinoma. So these three are the differential diagnoses. And investigations include barium meal study. So the findings include irregular filling defect, loss of rugosity in the stomach, and delayed emptying. So these three are the findings in the barium meal study. The first one is irregular filling defect, loss of rugosity, and delayed emptying. So next one is a gastroscopy with biopsy and endosonography, USG of the abdomen, CT abdomen, and liver function test, and prothrombin time, laparoscopy, tetracycline fluorescence test, and tumor markers test, CA72-4 PET and CT scan, sentinel node biopsy. So these are the investigations. So we've so far seen about the carcinoma of stomach, and we've covered the topics: etiology, pathological classification, and common site of occurrence, spread, TNM staging, features, presentation, differential diagnosis, and investigations.